Hello and good morning, dear viewers. You're most welcome again to the DAKTARI show, a health educative show which airs here on West Nile TV every Thursday from 10 a.m. to 11 a.m. And I'm always your host, Sunday Junior Tom. And to those who need our content, you can always catch us on Zuku. You can reach out on YouTube, you can reach out on Twitter, and you can reach out on Facebook to always get this content of these professionals. We bring in the doctors, the nurses, the dentists, and of recent last Thursday, we had doctors from Bonaventure Clinic who took us through some of the bad breath, what a bad breath is, and how to prevent a bad breath. Then also they showed us how can we brush our teeth. Today we have come with them back again, where they'll take us through gum diseases, the hard to show the teeth diseases itself. There are two, the teeth and the gum disease. So they'll differentiate them for us. Give us what are the causes, what are the risk factors. They will take us through if you don't manage these diseases. They will take us through those effects and complications and how you can treat them in case you get these signs and symptoms. Once again, you are most welcome to the DAKTARI show, Dr. Bayo. You can introduce yourself to our viewers.
Yeah, I'm Dr. Ndiri Bayo, a dental surgeon in Bonaventure Dental Care in Arua here. And we exclusively provide dental services, all dental services. Whether you have missing teeth, we can give you a smile. Whether you have a pain in your teeth, we can rectify that. So anything to do with the teeth and the gums, and including even accidents. If you are involved in an accident where you have lost your teeth, we can still handle that. And many other conditions that we also can refer or we can work on, depending on the institution. You are most welcome to this particular show of oral health, which is our main purpose here. Okay. Thank you.
All right, thanks very much, Doctor, again for giving in your time to come and educate our viewers on West Nile TV. So, Doctor, let's pick on immediately. What is the difference? You told me in a briefing before we came into this show that we have the gum disease and the hard tissue or the teeth disease. How different are those two?
In terms of our community, the most common diseases you will get in the mouth affect the gums or they affect the teeth. But the one which people know much and people complain a lot of is usually the tooth pain, which usually occurs, or tooth decay, which occurs in that particular tooth. This begins with the tooth structure itself, nothing. Things to do with gum diseases are now diseases which affect tissues which hold the teeth in the bone. That is things to do with the gum and other diseases that affect surrounding tissues that hold the teeth. But today, we are particularly going to deal with the most common, which is a tooth decay. What it is, the causes of the tooth decay, and then if not treated, where does it lead us? How can a death occur out of a mere tooth decay? So I think we need to examine that because it is still a common issue that happens. People are still dying in the villages. Teeth are still being removed with the arrows and the knives in the villages. We still get cases where somebody gets treatment and even still dies. So we need to have the community educated particularly on this. How do we handle a situation where you have a toothache? Right from the beginning, I will take you through that process up to the point when you will die if you don't care. That is really what we are interested in here because it is still a big problem, a big challenge in our communities. Okay. Thank you.
All right. Thank you very much, Doctor. So let's pick on immediately. What is a tooth decay?
A tooth decay, again, this is not a scientific term. A decay is just wearing off of the surface of a tooth. So a decay could occur on the sides of the tooth. It will occur on the top of the tooth, where it is visible to the patient, or it could occur on the sides. So all in all, what we are talking about here is the breach in continuity of the various layers of the tooth which occurs as a result of a process in the mouth. And that process is a very simple thing. What causes a tooth decay? A tooth decay, studies have actually shown that it is as a result of an acid. Acid is generated in the mouth. This acid settles on the grooves on the surface of the tooth or in between the pockets, in between teeth. And then over a long period of time, this acid actually drills the tooth slowly. It drills the tooth slowly. So if I want to illustrate for you a bit with this picture here, we have, this is a normal tooth. As you can see, it has 3 layers. That outer part, the white part which we usually see, and then there is a second layer which looks brown. This part which looks brown is a bit sensitive, where you will begin to feel something is happening. While the other part which is red is there, it has blood vessels and nerve fibers. So that is actually what constitutes a tooth. Now, what other things that you see here? These are the bones which hold the teeth to the jaw. So what really happens during the process of a decay? Once you are no longer taking care of your teeth, that means that you are not cleaning your mouth very thoroughly, and then the bacteria feed on the food particles that you eat and then generate acid. This acid settles on top of the tooth surfaces. Then over a long period of time, let's say not less than 3 years, unless in children below, let's say about 18 years, the decay rates are very high because the teeth are not so much calcified. So you find the decay rates are very high. It can take less than a year for a decay to reach that sensitive level or where it is so painful in children. But in an adult like me, it will take not less than 3 to 4 years for it to become so sensitive or so painful, unless I really keep my mouth so bad. So what really happens is this. I'm going to show for you another picture here. This is now an abnormal tooth. You can see at the beginning here, on top here, we have the decay process which is going on. The acid has been concentrated around this area, and then it is eating or corroding the surface of the tooth, that white part of the tooth. So when the decay process is in this first part, you don't feel anything. If it is in that outer part which is usually visible, you will see a black spot on your tooth, but that is the beginning of the decay process. So when you see a dark spot here, usually there is no pain, there is nothing, and we don't usually take care of it. But the truth is the decay process has started. Now, as this hole is neglected, no action is taken on it, the decay goes deeper and deeper. Then there will be a time when you take something cold, you will feel some pain.
Yes.
It will begin to last for few seconds, to minutes, to days, to hours, and then later on you find you have sleepless nights. That really now depends on the extent.
Okay.
Exactly what you experience when a tooth decay occurs is very definitive of the extent of damage that occurs in a tooth in the process of the decay.
The deeper the damage, the more the pain.
The more the pain and the longer it also takes.
Okay.
So if it is still up here, it takes a shorter period, and basically the body is telling you there is a problem. The body is telling you there is a problem. So as this decay process goes down, your experience changes. The sensitivity, people describe as sensitivity, later on it becomes pain, then later on you find it even translates, you begin to have a headache, even an earache kind of occur as a result of that. So that means that the pain is increasing as the hole is increasing.
Yeah.
So that is basically what happens.
Okay.
Yes.
All right. Thanks very much, Doctor. You have taken us through a process on how someone gets this tooth decay. You said it's as a result of acid accumulating in the teeth.
Yeah.
So maybe which things can someone do to predispose him or her to get this acid accumulate in the mouth to start digging the teeth or drilling the teeth?
Yeah, the issue here is in our mouth there are over 500 different species of bacteria. All these bacteria feed exactly on the foods that we eat. So you will realize that if you have just eaten food, let's say about 3 or 4 minutes, you find some bitterness in your mouth. I think we all experience that.
Yes.
That is actually the acid that is already being formed by the presence of the bacteria. The bacteria are part of us and they are part of the mouth. They feed on the exact foods that we eat and then they generate that acid.
Yeah.
So which means anything, if you want to avoid any decay process, avoid the growth of the bacteria, avoid the stay of the acid that has been generated in the mouth. Those are the 2 basic things that you should do. So everything that we do should be around reducing the population of bacteria, reducing the food content for the bacteria, and also reducing the surfaces of contact where the acid could accumulate and begin to drill the tooth surface. So this is exactly what now happens. Now, as the process begins, I said earlier that there are 3 layers of a tooth. The outer white layer, when it is in that position, there is no pain, there is nothing, you only see a dark spot.
Yes.
And at that point there, usually people don't take action. That is actually the time when you are supposed to take action because you will eliminate that hole immediately and the process of the decay actually stops. Now, when you ignore that, it goes to the second layer. In that second layer, nerve fibers are there from down. They infiltrate there. Then what happens is, if you take something cold, you begin to feel pain.
Even hot sometimes.
Yes. Actually, when hot comes as to tell you that it has gone deeper.
Oh.
Yes. At the beginning, it is just when you take something cold. When you take something cold, you find the pain comes. Now, as this progresses, now the severity increases, the length of the pain increases. That means the hole is also sinking and is going deeper and deeper. Now, by the time somebody actually begins to feel pain when you take something hot, it actually means that it is already in the 3rd layer or very, very close to the 3rd layer. That means the nerve fibers are involved and then the blood vessels are already involved. In that particular case, you will find that the severity and the period and the length, it begins at times without anything. You have not taken anything, the pain begins. You are sleeping quietly, you find the pain begins. So that kind of experience, it means that it has gone very, very deep. Now, that is the whole process of the decay. Now, this process continues. If you are untreated, what will happen is, what happens is, the nerve fibers, of course, they will die. When the nerve fibers die, that usually when that happens, you find somebody says, it is as if my other tooth is longer than the others. Because the nerve fibers inside have died, the infection is now spreading into the body. It is going past the tooth, and it is going to involve the surrounding tissues. The fibers which hold the tooth to the bone are going to be involved. Now, it is like there is a wound all around the tooth. So if you touched your teeth, what will happen is it is as if you are inserting a stick into a wound. That means the infection has spread all around the teeth. That is why it is very, very painful. It is very, very, you cannot actually bite your teeth at that stage. Now, if you don't do anything at this stage still, the body brings in its fighters and aggressively will begin to attack this. And it is already informing you that there is the body recognizes here the tooth as a foreign object now. So it will want it to go away. So at that stage there, you will find that because of the fighting that is taking place, pus begins to form at the tip of the root. This pus will begin to form. If you still don't take action, that is one root. Yes, one root is pus begin to form. That is an acute case. So pus begins to form. If you don't take that action, the pus will begin to dig the bone. And then as it tries to dig the bone to come out, to escape, then it enters the muscles. Yeah. That's why you find you have woken up with a swollen jaw. You still find we have people, the jaw is stolen, nothing still happens. And then you find the pus begins to spread From one small side, it crosses to the other side. What is called now Ludwig Sangaina. In that case, the pus has crossed from one side to another. Much as you see our bodies look like this, the muscles are really packed in layers, and there are spaces through which this pus can begin to move.
Yes.
Now you find this pus begins to move down under gravity, and by the time it reaches your chest, I am quite sure you are at a point of death.
Yeah.
You are really at a point of death. So when this infection reaches the chest, when it enters the chest, definitely I assure you, your chances of survival are now very, very little.
So it means someone should intervene very fast before
We
it
should actually intervene before any past state reaches. That is why the intervention should actually be from the point of seeing a dark spot on your tooth. You begin to intervene there. That is the beginning of the decay process. Why do you want to go to the painful bit of it? It is already getting costly on your side. So what you do is make sure that it does not reach there.
Yeah.
It does not reach there. However, we can still provide solutions in very many of the cases. So what usually happens is now, once the tooth, we are not going to begin to manage. I want us to go through what can be done.
Okay, so now someone, like, we assume that person has gotten those black spots in the teeth. Maybe it's getting those pain sensations.
Exactly.
When they come to what? How do you manage?
Exactly.
Yes.
That is, first we begin with the dental checkups. That is when the dental checkups matter. Because some of these decays happen in between the teeth, patients don't see it. We can see it with the x-rays, we can detect that there's a problem. Somebody has an unknown pain, he doesn't see any problem with the teeth. There could be a pain, there could be a decay happening on the sides of the tooth. So that is why the checkups still become important. Now, once you have come to us, what we shall do is assess the level of the decay and manage accordingly. At the top there are people, when you just see dark spots on the surface of the tooth, once you see that kind of dark spots on the surface of the tooth, what we can do is, without pain, we can eliminate those grooves. There are some people who are born, their grooves are extraordinarily large and deep. So what we do is we eliminate those grooves on the top of the surfaces, so that this acid does not clog and settle on the surface of the tooth. So we go inside with a thin bar, we remove those dark spots and eliminate those grooves, cement them. This is usually done even without an injection, without anything. We are sealing those grooves.
You said there is no pain there.
There is no pain. There is no pain. That is the beauty of being early. So we just clean those grooves, clean those dark spots, and then apply. There are medicines that we have. There are cement types that we have that can be applied at these various stages. Now, at that early stage, we just remove that black spot in the groove and seal it with one of our filling cements. Then, if yours has passed that stage, that means the white enamel or the outer part of the tooth is breached, it has reached the second layer, we still have a way of handling that. That depends on now what you narrate to us, the symptoms that you present with. When we are able to evaluate that, this thing is still in the second layer, it has not reached the third layer where the blood vessels and the nerves are. So at that level, we still have some drugs, we call them sedative. We can put them, and then it stops the whole process from continuing, and then a cement is done at that level. Here, we have not dug so much deep. Even at times, we just come and scoop that without you being injected. You will not feel any pain. It is a matter of scooping the dirty part of the tooth and then putting cement there. The tooth heals, the decay process is stopped, and your tooth is saved.
Yeah.
Now, if yours still has now bypassed that, you feel pain when you take something hot.
Yeah.
At times, biting on the tooth becomes a challenge.
So it brings pain.
Yes, that means the hole has really gone deep. In that particular case, we still have an option. In most cases, we now start what we call root canal treatment, because we now need to evacuate whatever has already sunk into the tooth and is already deep into the tooth. We now have to remove the remaining nerve fibers and blood vessels which are left there. We remove them. That is now the process of what we call root canal treatment. We go there and remove them. After removing them, we fill those root canals with some drugs, and then we build back the broken parts of the tooth. And then from there, the tooth begins to function again.
Yes.
Okay? The tooth begins to function again. And then, if you still cannot handle, in most cases, we are already reaching the past stage. Pus is already forming down there.
Yes.
Yeah, depending on whether you can afford or not. At that stage, you can either lose the tooth, we extract it out, or what we can do is we can still go up, down there and evacuate the pus, which is already forming down there. At times, that pus is, some people, they have tolerance in pain. You find somebody's tooth is paining for over 2 years, it's not bothered, until the body begins to form a sac down there, because food particles are entering, things are entering accumulating. So the body now begins to adjust. The body at the tip of the root begins to form a sac. This sac is to hold whatever passes through, whatever food particles, germs, and so on, and it forms a sac. And then eventually, what is called a cyst can develop. A cyst is just a sac which absorbs fluids from outside the body, and it prevents anything from inside itself from going into the body.
Yeah.
So it holds and it stops whatever comes, it will remain there. And then this cyst can begin to expand. And then also begins to eat again the bone and then find its way out. It gets infected. That's another route. The simple decay we had talked about can proceed. So you can see here, there are two routes here. Pus formation, infection spreads, and then a cyst forms, and then if it is detected, then an operation has to be done to remove that cyst out. You see? Yeah. That is another route the whole simple decay process can take. Now, we want to go through the pus process. Now, if root canal can be done, a tooth is saved, then that is well done. In a situation where pus has formed, definitely the only option we have is to make sure that this pus is drained.
Yes.
Now, our challenge is usually with the community. Let's say somebody has got a pus. Even at times, this pus comes out after an extraction. Actually, it may start before. Then, when the extraction is done, you find the pus remains at times there. The pus has not come out after the extraction has been done. It is still continue to progress. And then at the end of the day, you will find stories like so and so went to remove a tooth, and then after that, pus started. From there, the person has died. But what exactly happens there? Either the time the patient went to have the tooth removed, pus had already formed. Now, once pus has already formed, now when I pick out the tooth and I don't check down there, if pus is there, the pus still remains there. It will continue to operate. It will continue to spread. That's what happens. In this case, the dentist has come, has picked his tooth, and has gone, but has left the pus still there. You see? That's why we now need to be careful. Who is extracting your tooth? How is he extracting the tooth? Of course, here, if the person doesn't do cleaning up and doesn't check that he has done a good job and he has mopped whatever is there, has opened the way for the pus to come, and then you find the dentist or the person who has worked on your tooth will leave everything down there. The process of the spread of the infection continues. In most cases, you find they will blame the dentist because they say they removed the tooth, but the person ended up dying, which is to me, it is a combination.
Yes.
And then, still, if you went to remove a tooth and the swelling occurred after that, the question is, can something still be done? Yes. Actually, the problem is now this. Once somebody has gone to extract a tooth and the swelling has continued or it has spread, don't sit down there and say, you see, so and so went to remove the tooth and now you see the jaw is swollen, and here you are neglecting the person. Let this person go back to the dentist. The pus can still be handled. You see, the pus is only fighting to come out. Yeah. So if you went back to the dentist can find a way of opening up that space. and the pus can still come.
Okay, all right. Thanks very much, doctor. You have taken us through what a tooth decay is. You took us through the signs, like the pain.
Yes.
You took us through the complications,
Yes.
like the pus formation,
And
and
then
you have
death.
taken us through even the death. Then you took us through the management. So maybe you can summarize it up for us. If you may be asking, how can I prevent this tooth decay from happening in my life?
The tooth decay, the most important thing I will say is visit your dentist. Have a dentist of your own you trust. Let the dentist be the one to check your teeth. Let the dentist be the one to give you the education that you need. The most important thing is the education. That consultation that you pay, where somebody takes you through after assessing your mouth, after checking the nature of your teeth, is very, very important, because that they say 50% of the treatment has already been provided, so long as you are aware of what is happening in the mouth. So the most important thing is for for us to get a dentist who can work on it. For us here in Bonaventure, we do that. We actually, when you pay for our consultation, we educate you. We educate you on what to do based on what we have got in your mouth. So it is very, very important you get such a person, and the person is aware of what you are aware of personal what is happening. Then if you ignore it, when they have told you that there are 2-3 teeth which have decays and you have refused to go back to handle them, that is personal. Yeah. That is really personal. So first, get a dentist who can be able to talk to you about your oral hygiene and how you take care of it. Secondly, there are those 3 duties that you're supposed to perform at home. He will teach you. Cleaning your mouth, that is brushing, rinsing your mouth every time.
Briefly remind them on how often to brush.
Yes, we talked about this. We said that you should brush twice, in the morning, in the evening hours.
Yes.
I said twice in the morning, in the evening hours, because
Before
I said
going to sleep.
the first one is removing food particles and other things. Second one is
For
applying fluoride.
to remain in the teeth.
To remain the mouth so
Without
that it
rinsing.
carbs whatever decay is happening there. So that will happen in the morning, and then also in the evening hours you should do that. That is very, very important. And then the process of rinsing your mouth after every meal, in case you don't have a brushing at your workplace. Of course, the rules brush after every meal. So if you don't have that, make sure that you rinse your mouth thoroughly. Rinse your mouth is not just gargling water and spitting it down. Where you can rinse your mouth properly and squeeze the water, even massage your gums with your hands. That process is very, very interesting, and it should be done. And we have also now machines that can be used for syringing in between the teeth. You can do that. We have those machines which can be used for syringing, food particles that are left.
Removing.
Okay. Yes, you can have that done. Now, the third thing we talked about was regularly use the floss to clean in between the teeth. Once you have done that, you know that if you do that regularly and religiously, I tell you, you will cut 50% of your spending, if not 80%. That simple thing there will cut your expenditure, and secondly, you will avoid any mishappenings. A toothache can begin anytime when you are traveling, when you find because of the pain you slow down, and somebody not professional ends up tackling you, and you even get into more trouble. So I think that is really what we need to do.
Correct. Thanks very much, Doctor, for that discussion regarding tooth decay. Maybe your conclusion remarks, because in the next segment we are coming with Dr. Emmanuel.
Yeah. My advice based on this is this. A tooth decay is a preventable thing. You can prevent anything to do with tooth decay. Just make sure that you have your teeth examined regularly, at least twice in a year. Have your children examined, as particularly every holiday. You should have your children examined every holiday, especially parents. Becomes more costly. You have 2-3 children who are in Kampala or somewhere away from you in school, and they will call you in the middle of the term and they say, your child has a toothache. You have just been paying school fees, you're going to incur another one. But it is best if you can have these children examined over every holiday. For us here in Bonaventure Dental Care, We do take total care of people's oral hygiene and oral health care. We inform you on what to do. After every 6 months, we remind you that you have to come and we have to check you. So it will be good if you do come and have your teeth checked with us, and we'll be able to give you the necessary support that we can give.
Okay, all right. Thank you very much, Doctor, for giving in your time to come educate our viewers and also giving in your facility to educate the public. We are grateful. Let's first get into this short commercial break. We shall be back in the next segment with Dr. Emmanuel. Thank you.
West Nile TV, lighting up the region.
A brand new Global Star TV with StarTimes Inside Technology. New TV innovation with an inbuilt decoder that connects you to both StarTimes antenna and satellite signal. With StarTimes Inside Global Star TV, you can enjoy over 300 local and international channels, 1 month StarTimes highest bouquet for free, automatic system update, more benefits, more affordable. StarTimes Inside Global Star TV is available in all StarTimes branches and dealers countrywide. StarTimes Inside, entertainment inbuilt.
We are the passion you've been waiting for! Yunus Junior Santamu! It's our league, our football, our boys, our style. StarTimes UPL new season starts 15th September. Go for it! What a finish from Ashraf Bukume! The Ugandan flair, Brazilian samba, Portuguese magic, the night football craze. More TV games live on Senyuka Prime and Fufa TV only on StarTimes.
The StarTimes UPL, our league, go for it.
West Nile TV, lighting up the region.
We'll be back at the viewers from that short commercial break. Hope your morning is still fine. And the first segment, those who have just joined us, we had Dr. Bayo taking us through what tooth decay is. Then, as we told you earlier on, today we're going to handle a tooth decay, then also a gum disease. So in our next segment, we have Dr. Obia Emmanuel, who's going to take us through a gum disease. Maybe you can introduce yourself to our dear viewers, Doctor.
Yes, thank you very much, Mr. Tom and your colleague Elliot. Good morning, our dear listeners and viewers of West Nile TV. I'm really privileged to be here for the second time running now. So I'm really privileged because for us who serve here in Bonaventure Dental Care in the heart of Rose City, our mission is really to improve the dental and oral maxillofacial health care to the communities And this can be achieved through always by educating the masses and really by public awareness. And I believe what we are having right now is important in this sense. Thank you very much.
All right. Thank you very much, Doctor, also for giving in your time to come and educate the viewers of West Nile TV. So let's pick on immediately.
Yes.
What is a gum disease? Because I heard you pronounce in the briefing, there is gingivitis and periodontitis. Maybe in simple terms for our viewers, what are those gum diseases?
Thank you very much once again. When we talk about gingivitis, it's just more of a medical term in dentistry, but it's all to do with the gum disease. So when we put that term gingivitis, we are trying to mean inflammation of the gum. So gingivitis is just inflammation of the gums. So that is what it is all about. Now what brings about this inflammation is maybe what we need to understand for us to see how we can manage it if we are faced with such conditions. So as we said, gingivitis is inflammation of the gum. We know that our teeth are not just hanging in air. Our teeth are normally surrounded by structures. And out of those structures which surround your teeth, actually the gum is one of them, which fits snugly around the tooth. And that makes the tooth to be also firm. Actually, the gum is not the only structure around the tooth which brings out that strength, the support for the teeth. But we also have, like you can see in this structure of a normal tooth, we can see that there's the gum is here, which we can really see. And this one in the middle here is the bone. The bone, and this tooth has its roots fitted inside here. Even between the tooth, the root of the tooth, and this bone, there is what we call periodontal ligament. I could just say there are some fibers which connect like threads from the root of the tooth here to the bone, from here to the bone. So that thread there is also important in that support. So this is the gum, this is the bone, and these are some structures even on the root surface of the tooth here. We have some material which is called cementum. It actually covers that root surface, that anatomical root surface of the tooth. So those are some of the structures which are very important when it comes to the support of the teeth inside our jaws. So now here when we talk about gingivitis, we are now meaning that gum which we are showing for you that it's the inflammation of that gum. Yeah. But basically what normally causes this, the primary factor, the primary cause of gum disease is what is called dental plaque. Dental plaque is basically a buildup of bacteria on the surface of your teeth, on the surface of the structures you may be wearing on your teeth. You know that there may be people who must have lost some teeth, and also they are putting some artificial kind of teeth designed for them so that it improves their appearance, it improves their eating, it improves their talking, that kind of thing. So any structure which is in your mouth there, like the teeth, like those structures, so there's always a buildup of bacteria on the surfaces of those things, which is called dental plaque. So now this dental plaque, since it has the bacteria, many of those bacteria are actually harmful. So these bacteria, they can produce substances which are toxic to the body. So it actually now stimulates the body to try to respond to attack these toxic things they are producing. And that is what makes the body to respond by that inflammatory process we are talking about, because we said gingivitis is the inflammation of the gums. So the gum, when it is inflamed, it means there is a buildup of what? Bacteria on the structures on the teeth. Since the gum is not in isolation, it's also covering the tooth surface. So when it builds there, so you will find that the body tries to respond to attack. In the process, inflammation takes place, because
they swell like
inflammation actually is characterized by, it will actually lead us to now what are the signs or symptoms you can pick when somebody has gum disease when there's that inflammation. One of them is actually easily bleeding gums. Even you are just trying to brush your teeth with a very minor force and not really hard, with even a brush with soft bristles, you find you are having blood. You see, just light touch, the gum is bleeding. And the gum, even if its appearance will vary from the normal. You know, the gums are supposed to be, when they are normal, there are people where it is supposed to be coral pink. Or there are people where their gums are not pink, but they are like darkish grays, that kind of thing, but it's normal. But when it's not the normal form, you find this gum will tend to be reddish. Because of the inflammation, more blood is pouring there, more cells the body is preparing to attack these things is being taken up in that position. So there is the swelling, there is the redness in appearance of the gum, and there is also what? Easily bleeding. So this is basically the cause of gingivitis, which we say is the inflammation of the gums. So that is basically it. But there are some modifying factors. They may not primarily be the cause. There could be certain things which could modify this and make this worse. Just assuming like somebody who has like maybe he went to a dentist and they were trying to work on the teeth and try to put for him some restorations, like maybe fillings, so that maybe the tooth broke off and they were building it back. If the building was not done okay and it has some, the shape was not brought well and it has some hanging margins which are rough, you know, plaque now likes that retentive areas. It can retain in those areas and worsen the condition. You can also have somebody who is diabetic and his sugar levels are not being controlled well. Now, when the sugar levels are not controlled well, you know, it will affect the healing. When he has just minor like irritations from these toxins which are produced by these bacteria which are in the dental plaque, which is always accumulating on those surfaces, you'll find that for him, he will not respond well, because now the high sugar levels, glucose levels in the blood, will make this body's response to attack to be weakened and they will not function well. So in such a person, it can worsen the gingivitis. There are also other conditions which can do the same. Maybe somebody might be a smoker, and the smoking can also affect his the gum disease in such a person who is a smoker can also be worse. But again, another funny thing in smoking is that actual smoking, because of some substances in them, there are substances in the smoke which you have there, like nicotine and so on. They have some effects to the blood vessels, which kind of, they normally say vasoconstriction, like they narrow those blood vessels which supply there. Actually, blood does not flow there. So sometimes when somebody is a smoker, you need to be careful, like in assessing such person for gingivitis, because you may say that this person does not have a serious gingivitis when actually he has, because when the blood vessels are like constricted and the blood does not flow there well, actually in such a person you do not see the gums so reddish. Like in a person who is a non-smoker, you don't see them like bleeding easily, like someone who is a non-smoker. So you need to also know those when you are doing your assessment. But in a nutshell, gingivitis is just inflammation of the gums. It's the inflammation of the gums, and the primary cause is dental plaque. Yeah. Where I said plaque is just basically build-up of bacteria. Yes. Which normally, even if you brush, just few minutes or hours after brushing, the plaque starts coating again. The tooth surfaces or the structures which are in your teeth, it starts coating them. That is why oral hygiene is key in this. And gingivitis is a reversible condition. And once you do oral hygiene and you always make sure you get rid of the plaque, it means you recover fully, because it's not like irreversible. Where we are going to go, like we are going to talk about also periodontitis. When we talk of periodontium, these are now the structures which are supporting the teeth, which I've been talking about. Yeah. I talked about the gum itself being part, the bone being part, the alveolar bone there being part, the fibers which we call periodontal ligament, but you can just call they are those fibers which connect from the root of the tooth to the bone to keep the tooth there. We also have cementum which lies on the surface. So those are the structures now around the tooth. So now, the other time when we talked about tooth brushing, I mentioned something about sulcus. I said that there is some space which is between the tooth and the gums. There is a space. Yeah. The depth is just, it's not so much. It's like, in normal cases, it's less than 3 millimeters always. But you find when plaque accumulates there and it begins to bring inflammation and it is not managed well, that thing can progress. It can begin to damage the tissues there, progressing in between there, causing like a pocket which is deeper than now the sulcus which we are talking about, which is normal. And this can now actually progress to what we now call periodontitis, because periodontitis is now inflammation of the structures which now support the teeth. All those structures can be involved. If gingivitis is not managed well, it can progress to what? Periodontitis, where now the structures around are involved. You know, when plaque builds up and it's not removed, when it takes more time, it begins to, the minerals in your mouth, in your organic minerals, it begins to harden. And when it hardens, it becomes what is called tartar or calculus. I have an image here. You can see this person. This person basically now has what we call periodontitis, because you can see, if you see these teeth here, most of these teeth, the neck is around here, like the necks are here, but you can see there's this heavy coating on the teeth, which makes them to look really ugly. There are people out there in the community who might be carrying these kind of things, and these are not normal things. Now, when it reaches this stage, this is actually now tartar, or you can call it calculus, or you can call it tartar. This is now very hard. Actually, this one toothbrush cannot remove this thing because it is hard, it is calcified, it is well attached to the tooth that a toothbrush can never remove it. You can only remove this when you go to a dentist, where they do for you what they call scaling and root planning, those procedures where you can only remove these things. So it means that before you reach here, you need to handle the gingivitis, you need to handle the plaque before the plaque matures to this stage. So now when it reaches this stage, where now the gum which was fitting around the neck of the tooth has moved downwards, and you now see the root of the tooth is appearing out. This one is no longer now gingivitis. It is now what? Periodontitis. Now the structures around are affected. The gum is going downwards, it's receding and exposing the root of the tooth. And then also the bone which was around here is also going just silently. By the way, another funny thing with this condition is the thing is not painful actually at start. So people just move, they think these are normal, but no. You can even see now there are these areas which are normally filled with the gum tissue in a triangular form here very nicely. Now they are no longer there. They are now spaces, open spaces. And some teeth appear now very long and are normal because most of the roots are now out. This is now a case of what? Periodontitis, where you can end up in losing a tooth. You can lose a tooth not because you have a decay, but just because you have periodontal disease.
Okay.
When we talk of, like you have periodontitis, which is now in like a severe form, because now when it is in the early stages, the tooth, you cannot lose the tooth. But when it goes to severe stages, you find the tooth now becomes even loose. You cannot use it for biting. You will now find the tooth is, the roots are exposed outside. Okay. You see that kind of thing.
So now, doctor,
yes.
When someone has these teeth, how do you always manage them?
Okay, now when we manage this, it normally depends on the stage. The stage. There are moments where now these cases can be so severe that the teeth can be very mobile in your mouth that you cannot now stabilize them anymore, which we normally call hopeless teeth. So in that kind of case, there's nothing you can do. You just have to remove the teeth. Maybe you will have to put for such a person an artificial teeth which is designed so that his appearance can be maintained, his talking can be maintained, his even eating can be maintained. You know, the teeth has so many uses. Now, some of you who are media specialists, now when you are a news anchor, assuming now you have lost so many teeth here, you are coming, how do you manage that? It disturbs you. Psychologically, it disturbs you. So, we really need to take care when we are really actually at the stage of gingivitis. But even if you have progressed and there's some bit of periodontitis, when the teeth are still not loose, when the teeth are still, they are stable, you can even eat on them. The only thing is now to get rid of the build-up which was there so that they cannot now progress further. You see that kind of thing?
Yeah.
Yes. So actually the difference now between the gingivitis
And the periodontitis
is that actually in gingivitis, it's only the gums which are basically affected. And you only have things like the appearance, the reddish gums, the swelling of the gums, and bleeding of the gums. But when now you reach periodontitis, you find the root of the tooth is getting exposed out, you find the teeth are becoming mobile, you are finding there's wider spaces in between the teeth because the bone which was surrounding the tooth, those structures surrounding the tooth snugly are now going away. You find spaces are bigger between the teeth. Sometimes some people complain that when I eat, things get stuck between my teeth, when even it's not because of tooth decay, when there's no hole, because now the spaces there, they're supposed to be in certain size, narrow spaces, not really wide. When they are not wide, anything can enter there and disturb you. And another funny thing is once the root of a tooth is exposed out, you also begin to get sensitivity issues because the root of a tooth is similar to the dentine, which normally responds to cold things or maybe things which are even changes in pH, acidic thing, that kind of thing. You get sensitivities, irritations, that kind of thing.
So now, doctor, you have taken us through these gum diseases.
Yes.
And indeed it is scaring according to this image. So how can someone in the community prevent himself to get such teeth?
In fact, first of all, I think that is why we're here. We really need to get people to understand there are conditions which can happen in them, because some of these conditions you find so many people have it. Like gingivitis, I can say there's no one who has not suffered from gingivitis, only that the degrees vary. Even us, because this is a condition which is you just brush your teeth now, maybe after a few hours from now, plaque is already building up there. You can have that mild form which is already taking place there. So the only thing is to always start from good oral hygiene. You have to brush, you have to floss. Then that is to keep away gingivitis so that it doesn't progress to periodontitis. But also you have to have regular checkups and see the dentist, so that you can be identified, these conditions can be identified in case they are there, they are managed early. You know, it is better to prevent than to go to cure things. Because when you go for now, like treatment or cure stage, to be more expensive, more demanding, even in terms of time and so on. So it is always good to prevent. So seeing the dentist regularly is important thing. Also, your oral hygiene at home, which you do yourself, is important. But also, I think we also have a role to play. That's why we always come on board and try to educate people, because there may be people outside there who do not know about these conditions. They may think these build-ups are normal. Because, you know, sometimes when people see these things, sometimes people even fear to tell you, because they think that when they tell you these things, that like if I tell you, Tom, you see your teeth, you have issues, where it's like I'm embarrassing you. So like, but these are facts, and we needed to tell people about these things so that they can come out and know that these are things which are not normal. We need to get rid of these things. Yes.
Okay. All right. Thank you very much, doctor. You have taken us through management. But maybe like let's handle some complication part of it. In case someone in the community fails to manage these gum diseases, which complications or side effects or effects do these people get?
First of all, now you don't manage the gum disease. The gum disease, which we talked about as gingivitis, will have to progress to periodontitis. Now, when it goes to periodontitis, which is now the disease of the structures which are around the teeth, which are supporting the teeth. I can just give an example like of a tree. You see a tree, the tree is always firm because the roots are in the soil. And the roots, when they grow in the soil, they are long distances in the soil, it keeps that tree. The tree cannot, even wind comes, it cannot blow it. But now, when the soil around the roots are all carried away, that tree just collapses. That is exactly now what can happen with what? Periodontitis. Because when the structures are around, when the bone is now lost, and quietly, with no much pain, and then the periodontal ligaments are lost, and then the gum is being receding downwards, the support around goes. And when the tooth is lost, is removed, then you are going to be without tooth or without teeth. Now, when your teeth are not there, what challenges do you have? Your appearance, even laughing, will become a problem to you. Smiling is going to be a problem to you. Eating is going to be a problem to you. Because even you are going to choose your diet now selectively. Because your teeth, even if others are not lost, but they are loose in your mouth. When something is loose, by the way, you can't bite on it very well. When you bite with a stronger force, it will actually hurt you. So your diet will be kind of segregated, and then you are not going to be kind of eating some things which are important for like your nutrition. Even now, like talking alone, you know, this talking here comes very nicely when your teeth are there. You just miss so many teeth here and you try to talk and you see how it will come out. That phonetics, it is all about the teeth. So even issues to do with, you will get complications like, I don't wish anybody like getting accidents and so on, but in case you get accidents and you fracture your jaws, you know, sometimes we immobilize those fractures by using some wires which are normally attached to the teeth when you are immobilizing the fracture there. You see, when you break normally your arm or what, they put something there and which so that those bones are raised there and it is kept in that position, doesn't move, and it keeps on healing in that position. And for us, when you break the jaws, the teeth are important in that process. They use now some wires and attach them to teeth and bring those bones in one place, and it heals in that position. Assuming now you don't have the teeth, what are you going to do?
There is nothing.
You can do other things, but it's very expensive. Where they normally do, they go and put some plates and what. Surgeries which take millions and millions of money. I don't think our people here can really afford those things. And maybe sometimes even those procedures may be done in some bigger places like maybe National Referral Hospital like Mulago and so on. It may be really very, very difficult for you. So that can also be another problem.
Yes.
Yes.
All right. Thank you very much, Doctor. You have taken us through these gum diseases.
Yes.
So now you took us through even the management. You have taken us through the prevention. Is there anything like you feel like you should communicate to the public on how they can prevent this gum disease? Very specific.
Just now to our dear listeners outside there, this condition is purely preventable because I told you when you yet have the plaque, which is the coating around on the teeth, but that coating is mostly made up of bacteria, which normally stimulates all this. It's the primary factor. Other things are just like predisposing factors, that kind of thing. So I would just really rather say to them that oral hygiene, good oral hygiene is key in preventing this. You have to brush at least twice a day, which is the recommended. The other time I talked to you about the timing before going to bed and after breakfast in the morning, minimum of two times. But also when you brush, you leave the toothpaste in your mouth. You just spit the foam only, because the fluoride in the toothpaste, it has some antibacterial properties, it has some decay, let me say reversing properties. So it is very important.
Yes.
We just have to take like maybe 2,000 to buy that toothpaste there, to buy the brush there, and you prevent something where if you are to be managed, you are going to pay for the consultation, you are paying for the procedure, you are paying hundreds or thousands of money, which may not be there at that time. Prevention, just oral hygiene is key. Maybe there are people who might have some systemic diseases, like conditions like diabetes and so on. If you know that you have such a condition, because now current study shows that out of the complications of diabetes mellitus, periodontitis is one of them. It's now the 6th complication which they have added currently. So it means that when you have diabetes outside there, you are prone to have what? You are prone to have what? Periodontal disease, which has gingivitis, periodontitis. So now, how should you prevent that? Apart from the brushing, flossing, and so on, for you have to go extra mile on using your anti-diabetic drugs properly, just like your physician has told you, so that your sugar levels are always well controlled.
Yes.
When the sugar levels are well controlled, you'll just be like any other person who is not diabetic. But when the sugar level is not controlled, you are going to be more vulnerable than somebody who is not diabetic. Thank you.
All right. Thank you too very much, Doctor. We are indeed grateful for giving in your time always to come and educate the viewers of West Nile TV.
Thank you so much.
At large in West Nile and Uganda at large. And also we are grateful for always giving in your facilities. And also to our viewers who have been with us from the start of the show up to the climax of the show. We are grateful to you and we wish you all the best of your morning. Maybe Doctor, goodbye to our viewers.
Okay, have a nice morning and we meet next time. Hopefully that this program will run so that we really bring out there more topics. Thank you.
All right, thank you very much, Dr. Obia Emmanuel. And also thank you, our viewers, and also to the cameraman, Director Elliot.
Yes.
Have a blessed morning. Thank you, our viewers.
Amen.